Thank you for watching this video. This is West Chase Wellness Chiropractic Center. My name is Dr. Huang, and we have a patient here with sciatic pain on the lower back. And what we're going to do is use this ortho stem to adjust his lower back. What we have here on the table, this table, normal table is flat like this. I have in kind of like this shape to tap into the facet and open up his facet. And we're going to do that with this tool here. Here we go here. I like to use this technique because it's opening up the lower back, help them function better, get them to get the nerve unpinched because he's got a nerve irritation in his lower back, causing the sciatic pain. So I'm hitting a little bit of the sacrum right now and go back to the lumbar. Just open up the lumbar. The lumbar has a lot to do with it. Believe it or not, this guy used to play hockey sack. He used to play hockey sack with his feet and play like a volleyball kind of thing with a hockey sack over the net. It's very impressive. He's a creator, inventor almost. Got a lot of people get together and play a lot of that. That back in the old days. This helps him just feel better. And he walks with a limp right now, and he does have a limp still after we get done. However, each visit built on top of each visit, and he will get better every time he comes in. I like to get the neck also because it really helps get the lower back all talking to each other. Neck and lower back are brothers relationship. And the thoracic, which is right around here, is thoracic, and this is the lumbar sacrum area, and they're brothers. So lumbar and neck is brother, the thoracic and sacrum are brothers. So it's pretty neat. You work on whole spine, so the body could talk to each other correctly. That's really good right there. Next we're going to do is use the percussor. We're going to work on his lower back and the sacrum a little bit. It really does a good job of managing his discomfort he has. And managing that's what we want to do, make sure everything's in good shape. Because he's got chronic lower back pain. It comes and goes, but right now it's been flared up a little bit, and we're here to get him well. So I like to take the leg and go into active range of motion on him to break up the scar tissue he has in his lower back. Really helps with that. Our goal is for him to feel better, function better, move better, and so he can live a longer quality of life. And he wants that. Everyone wants to have that mobility improvement. As we get older, mobility is what we need to continue working on. Stretching, increase your range of motion is important because as we get older, our range of motion starts decreasing. You want to increase that range of motion. To do that, Pilates is great, yoga is great to get your flexibility up, and Pilates is great because it gives you flexibility and strength to help you build those muscles. A really excellent way to do it. And it's free if you do it at home. You can just get on a table and start stretching and get your body feeling better. And we want everyone that comes in here feeling that way because we like to feel without pain. Working at the sciatic nerve right now, right at this point here, where the piriformis sits over the sciatic nerve, and the piriformis could be tight and causing sciatic discomfort. Just breaking up the scar tissue on his glutes a little bit also. Continue breaking up the muscle. When the sciatic nerve, for example, the piriformis gets a little bit looser and has a lot of scar tissue on it, it can help him feel better too. Bad knee. He has a bad knee, that's correct. Yes. So he has a bad knee. We want to make sure the knee's feeling better also. The knee could be part of the low back issue, or he does have a condition on the knee itself. Now he's ready for the dropping table technique right now. We're gonna make the table even out a little bit. So this piece is up. I'm gonna lower down for him now. Good. So it's lowered, and this piece lower a little bit. Support the table here and lower him. Good. Now we're gonna raise the table up. I'm gonna start using the drop table on him now. So that's almost there. That should be good there. Okay, let me just get the table ready here. Awesome. Very good. The goal is get the neck moving so the lower back feels better too. We have 7 bones in the neck, and I get all 7 bones by moving this way. Get them and go into the hyperextension like this. While dropping down, it helps you because we look down a lot on cell phone, for example, computer, tablet. All those are what we typically like to do as human beings. Look down, look down. Just 1 second here. Good. Good. Very good. Good. Upper T1, T2 is very important to adjust. Very good. Very, very good, Tim. Very good. Now let's get the thoracic right here. Awesome. Almost there. It dropped again. Let's get that. Awesome. 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 Good. 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 Awesome there. Awesome there. I like dropping down the people's spine because it really helps the spine move better. everyone has some kind of misalignment in their spine. By doing this, it helps prevent future wear and tear. Good. Good. Very good. Now I'm going to check his length right now. Good. Bend the knee a little bit to see where he's at. His right knee is a little bit tight. Cramping? So he's got a little cramp on the right side. It's better now. It's okay. The right side is a little bit tight. Let's adjust that right knee. The right side here, the knee problem, that's why he can't bend that much. But hopefully doing this dropping, we'll see some kind of improvement on the range of motion on the knee itself. Good, let's go check him out now and see where he's at. We're going to be careful on his knee again. So it's a little bit better already. Let's do that one more time. Good. Good. That's really, really good. Let's go check it out now. So it's much better. Not perfect, but much better. Now we're going to work on the sacrum and the lower back for him. So this helps separate the facet and the lumbar area. Help him pushing down on the sacrum. Now we're going to do the lumbar, create spacing between the facet and the lumbar area. Very good, let's do that again. Let's do that one more time. Lumbar. There's 5 bones in the lumbar. We adjust all 5 segments, grabbing the spinous process and pushing down, moving forward to create that spacing. Really awesome there. So that's good adjustment. Now we're going to use a hand adjustment. We call it manual adjustment on him now. Okay. Take a deep breath in and hold it. Good. 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 Breathe out. Breathe out. Breathe out. Good. 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 Thank you. That was really good. Good, thank you. All right, let's go to the other side here. Good. Lay on your side for me, please.
Roll that paper.
Turn that way. We will roll that paper for you. You sweated quite a bit, and we'll change it out. There we go. Go to your side for me, please. Perfect. Just like that. Now we're going to adjust his lower back. Just leg straight here. Just like bent. A little more straighter for me, like that. Perfect. So we'll get you a bit of balance here. There we go. Breathe in. Breathe out. Good. 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 Other side for me. Good.
A little bit better.
His mobility is getting better, of course. Just take time and efficiency to make it for his spine to move better. Every time he comes in, it gets a little better. Just a little bit better. That's a goal. Breathe in. Breathe out. Good. 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 On your back, face up. Perfect. All right, now we're going to do a hug one. Called a hug adjustment. Here we go. Good. Put my hand on his spine and thrust down. Very good. Let's go down to the next area. Thank you. Let's go to the next area. Thank you. One more time. I think I got one more in the other right there. Oh, that's nice. Now we're gonna do a Y strap. And he likes the Y strap because it's called manual decompression move on the patient like this. So this is called the Y strap here. We'll do this almost every patient in the office. Really helps them decompress. Good. Perfect. Perfect. All right, just relax there. We'll distract you a little bit first and then have him sit there. And he doesn't know where I'm going to pull, how I'm going to pull. He doesn't know, but he knows it's coming. There we go.
Oh, that's a good one.
And he said, that's a good one. Yes. It creates a separation to supposed to get to a lower back. And some people don't get to a lower back. Some people do. Some people just get caught in the neck area. We want to get to a lower back area. So that's the goal of decompression on him. And you vary the tension on the pull, of course, an individual. Okay. Good. Good. Other side. Good. 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 Let's go to the other side here. Very good. I like to pull on the ear because adjusting the ear is really, really awesome. Good. Good. Come on up. Help him up right there. He'll sit in a comfortable position here. Next, we're going to use orthostim to tap his neck. This is a great tool. Help him increase his range of motion. What's what we want people to have? Better range of motion as we get older. How about that? If you sit in front of a computer all the time, and this seems to be real beneficial. It is. Everyone that has a spine needs a good chiropractor. Everyone has a teeth must go to see a dentist, right? So we want to make sure the spine is taken care of all the time, the whole time you're alive, because that's where the nervous system sits, and you're only born in one nervous system. You want to take good care of it so you can function well, move better, prevent future wear and tear. That's what we try to do here. So you see me going up and down, it really helps unlock the facet and the spine, and it's talking. The lower back's talking to the lower back, neck, and the neck and the lower back's talking to each other right now, and it's getting a little better. Now we're gonna get the thoracic upper back.
Taking a right turn, I have to look.
Yeah.
Like this for cars.
Yes.
A lot better range of motion.
Yes, that's a key. That's a goal. That's a goal for us to have patient realize the aha moment. You know, I used to have a headache. I don't have those headaches anymore. You know, I used to have arm pain, and my arm pain seems to be dissipating. I don't feel that arm pain that often anymore. And those are the little things people forget about, you know. And these are the things we want to encourage them to. Chiropractic is benefit for them, and really helps them function better. Now I'm just getting one more thing on his C1 right here for him to function better here. I use the activator to align the C1 and just check the vector. It has improved. Let's do a few more time here. When C1s go into proper alignment, the rest of the body kind of flows into it. So please like the video, share the video, and hit the subscribe button so you know when the next time we have a new video on file. Thank you.